Good morning everyone. My name is Dr. Nikhil Kumar Soni, Assistant Professor, Department of ENT, Mahatma Gandhi Medical College. Today we will discuss about the functional endoscopic sinus surgery. What is the purpose of doing functional endoscopic sinus surgery? The purpose of Fess is to restore the normal drainage of the sinus. Normal function of the sinus require ventilation through the ostia and this is facilitated by the mucociliary transport process that maintain a constant flow of mucus out of the sinuses. All sinuses need ventilation to prevent infection and stasis of the secretions. In healthy individuals, sinus ventilation occurs through the ostia into the nose. The primary objective of the Messer-Klinger approach championed by the Stemberger is the removal of the pathology in the osteomeatal complex sufficient to achieve ventilation and drainage, thereby addressing the underlying pathophysiology by a conservative approach. Hence the term functional endorsed by the Kennedy. Fess functional endoscopic sinus surgery is therefore only appropriate when performing limited surgery with preservation of the existing structures and should not be used for the many surgical indications for which the endoscopes may now be utilized. Example: orbital decompression and the dacryocysto-rhinostomy. A large number of acronyms have since appeared: MAS, microscopic endonasal sinus surgery; MIS, minimally invasive sinus surgery; TSS, transitional space surgery. Fess offers several advantages. It is minimally invasive procedure. It does not disturb healthy tissue. It is performed in less time with better results. It minimizes the bleeding and scarring. The term Fess was coined by the Professor Kennedy. Endoscopic orbital decompression was first described by Kennedy and Michael in early 90s. Over the years, enhanced visualization of the key anatomic landmarks such as the region of the orbital apex, which is the critical area of decompression in orbital neuropathy, has made endoscopic sinus surgery a versatile tool. Indications for the endoscopic sinus surgery. Endoscopic sinus surgery is most commonly performed for the inflammatory and the infectious sinus diseases. The most common indications for the endoscopic sinus surgeries are as follows: chronic sinusitis refractory to the medical treatment, recurrent sinusitis, nasal polyposis, enterocoinal polyps, sinus mucocils, excision of the selected tumors, CSF leak closure, orbital decompressions. Optic nerve decompression, dacryocysto-rhinostomy, coinal atresia repair, foreign body removals, epistaxis control. What are the techniques of Fess? There are two approaches. One is anterior to posterior and another is posterior to anterior. Anterior to posterior approach is called as Stemberger's technique. This proceeds from uncinate process to sphenoid sinus. Preferred advantage is to the tailor to the extent of the surgery to the extent of the disease. Posterior to anterior starts from posterior to anterior from sphenoid sinus and proceed anteriorly along the base of skull and medial orbital wall, mostly done only in extensive polyposis or in the revision phases. What are the goals of surgery? Surgery in patient with rhinosinusitis can have several goals. These goals very much depend on the nature of the underlying pathology. Opening sinus ostia to help restore mucociliary function, removing the diseased tissue to relieve the symptoms of nasal obstruction, aiding the delivery and distribution of the topical nasal treatment to any diseased mucosa and in particular to the paranasal sinuses, reducing the surface area from which the diseased mucosa arises, polyposis. Opening the olfactory cleft to improve the sense of smell, removal of the diseased tissue in benign nasal lesions, removal of the foreign material from the sinuses, example dental root in the maxillary sinus or the saprophytic aspergillosis, reducing the mucosa contact. This is through by some to be a factor in the etiology of the polyposis. Removing contact areas also improves mucociliary clearance, removal of bony anatomical variations causing obstruction of the airways like concha bullosa. Introduction. Examination of nose has been revolutionized by the advent of the nasal endoscopes. It comes in the following sizes: 7 mm, 4 mm. It comes in various angulations, namely 0 degree, 30 degree, 45 degree, 70 degree. The 2.7 mm endoscope is used for diagnostic nasal endoscopy in children. For diagnostic nasal endoscopy, it is better to use a 2.7 mm 30 degree nasal endoscope if available. A 4 mm 30 degree nasal endoscope can also be used for diagnostic nasal endoscopy in adults. Various endoscopes of 0 degree, 30 degree, 45 degree, 70 degree are used of various sizes 2.7 mm and 4 mm. Camera, single chip, triple chip, double chip, HD, light source, halogen, xenon or LED light source are used, and the cables are used. This is the endoscopy unit used for various nasal endoscopies and surgeries, sinus surgeries. These are the endoscopes and the instruments used in the functional endoscopic sinus surgery. Pre-operative evolution, antibiotic therapy 3 to 4 weeks in general for chronic rhinosinusitis with antihistaminics and mucolytics. Corticosteroids 1 to 2 weeks prior to the surgery. Nasal endoscopy 0 degree, 30 degree and 45 degree is done to identify the anatomical variations and other obstructions to take endoscopic guided culture. The process of examination can be divided into 3 passes: first pass, second pass and the third pass. What are the preoperative preparations? History. Thorough history of the patient is important as to evaluate the obstruction is mechanical or this is due to any infections. Physical examination is done, endoscopy, pre-op endoscopy is done, and the pre-op CT scan is done to know the extent of the disease within the sinuses, obstruction of ostia, any anatomical variations. The pathology, previous pathology reports are needed. CT scan, nose and PNS. Various cuts like coronal, axial and the sagittal cuts are needed. Better imaging, axial cuts are needed for the better imaging of the frontal sinus, but the coronal cuts are the most important to know the surgical anatomy of the sinuses. Indications of MRI: dehiscence of the ethmoid roof, frontal sinus, sphenoid wall. These are the indications. Thank you.